Okay, so this slide we're going to talk about acne and rosacea. So acne, which is like in Chinese, 青春痘. Rosacea is like 酒糟鼻, yeah, you know, 酒糟鼻. So sometimes the symptom between acne and rosacea can be can looks a bit similar, but the reason behind to for acne and rosacea can be is totally different. And the first one for acne, you normally can see two different acne. One is white head, the other one is called black head. Yeah, the difference is one is closed. Yeah, when the skin is closed, is which means the all the what's a sabine is underneath, and when the skin is open, because the dust when that accumulate into that pore, it can cause the color become black. Okay, so you can see that normally acne when that is non-inflamed, the white head is the see here is the skin is not open, so that's why is we call not open, which is whitehead. When the skin is open and the dirty things accumulate, and that's what we call blackhead. That's non-inflamed, which is no still in the early stage. Okay, so this one's the same. This is a normal skin. So when you see the for the close acne, which is whitehead, because when your Comedo produced a lot of uh, the fatty oil fat things, it can accumulate, and once getting a lot, it block and also cause the skin to open, and the dirty, the dust or they get accumulate here, they'll become look black. And the next one, when the bacterial involved, that blue dot that is for bacteria. Because for those sabun, this is very good food for bacteria. So when the bacteria involved, it will start getting inflamed. Okay, this is how the inflamed pimple look like. You can see on the pimple in the surrounding area is getting red. So in this case, this pimple is not is inflamed because you can see the color change. It's not just like normal white or normal black. It's inflamed. And what causes acne? Normally, your genes, or when you under stress, or sometimes your diet, or sometimes when you're overweight, or not exercise enough, or sometimes when you are pregnant as well. And the last one is called polycystic or ovarian syndrome. 这个就是我们中文说的什么巧克力囊肿。Yeah. So those cause can make your acne, can cause the acne. And how do we treat? Yeah, since we know what caused the acne or the pimple, so the first thing is cleaning. Cleaning is very important, and you unblock the hair follicle, reduce the sebum production, or reduce the bacteria on the skin, and also reduce the skin inflammation. That's how we treat acne. So that's why a lot of product in the pharmacy or over the counter, it just help to clean the skin. or kill the germ, kill the bacteria, yeah, or reduce the production for the sebum. Normally, the non-prescription treatment, yeah, just like I mentioned, cleaner, skin cleanser, or salicylic acid or sulfur cream, because this one, they can unblock the hair follicle. And the benzoyl peroxide cream, you can see here, there's the chemical group called peroxide. When you see peroxide, you will see it definitely can kill the bacteria, right? So by kill the germ, you can reduce the comedal formation and also the skin bacteria. Or the last one is called azelaic acid cream. Azelaic acid cream 在中文叫做杜鹃花酸。So that's something can regulate the skin, reduce your pimple formation, and also reduce the bacteria. So this is benzoyl peroxide， 它是一种 peroxide， 就是所谓的过氧化物，就类似像双氧水的这种东西。Okay, so normally over the counter it comes in like 2%, 5%, or 10%. So when you recommend any product like this, you have to tell them to start with lower strength because the patient's skin tend to be sensitive when they first use this type of cream. So they need to start with 2% and slowly you use once a day. Once the skin get used to it, they can use twice a day. And they then slowly increase the strength to 5% or 10%. Yeah. So you can see the principle behind here. I repeat that again. Is you start from lower strengths, and this cream can cause skin irritation. So you have to mention to the patient if the irritation is quite severe, maybe stop using it or use less frequently. And also this cream is because it's got a peroxide in it, so it can bleach your hair or fabric. So if they have to wear their clothes and you have to advise them that might bleach their fabric. 因为这里面有过氧化物，所以如果你有沾到一些衣服啦，或者是头发，它都会让这些东西变白啊，所以你要提醒一下病人。Okay, the azelaic acid, yeah, normally is a natural material, so it's produced by yeast, and they normally live on the normal skin. Okay, so the commercial product is called Finacea. Finacea. I'm not sure whether you can see it in Taiwan. Okay, so this one, azelaic acid, can work as a antibacterial because it will reduce the growth for the bacteria, and also it can be as a corruptolytic， 它是可以融化那个角质的，而且还有这个 comedolytic， 它可以去除减少这个脓包青春对这个脓包的产生 ，and it will return to the normal skin states. Yeah, it can regulate the skin and also reduce the free radical, which it will reduce the inflammation. Okay, and when you want to treat the acne with prescription item, normally you will consider antibiotic. Or sometimes doctor might prescribe the contraceptive pill, but it's a lower dose. Okay, that will help. Sometimes if the acne is quite severe, doctor sometimes will prescribe the pill. Or sometimes they use retinol acid or retinol， 这是属于类似维他命 A 酸的东西啊，维他命 A 的这种产物。 Or sometimes the oral tablet is isotretinoin. The trade name is Roaccutane. Roaccutane. So 这个药也是一种类似维他命 A 的一种结构像维他命 A 的一种药。So any vitamin A product, when you recommend to the patient, you have to you have to you have to ask them, see whether they are getting pregnant, because vitamin A is not higher dose is not recommended for pregnancy, pregnant women. Rosacea, you can see the rose, so which means the patches for the skin for this rosacea will look like a rose. The color is a little bit pink. No, not because it's sometimes it can be 在中文里面，他会认为是酒糟鼻，是因为有些人是以为是说他们有长期喝酒，那个看起来好像差不多，but actually, they looks slightly different. Rosacea, it looked like this. Okay, from this lady, you probably will think, oh, this lady might have the what's that? SLE something 那个红斑性狼疮，but sometimes it's not SLE. It's just a rosacea. Okay, it normally happen near the nose area. When the symptom gets severe or getting longer, it will look like this. There are so many types for the rosacea. You can have a look for the definition here. And normally here, it will tell you the different, the vascular, inflammatory, or ocular. Ocular mean in the eye area involved, then you will call it ocular. Yeah, and it started with the patches near the nose. Okay. And once they started, at the beginning, it's very mild, and later on, maybe sometimes bacteria or other stop kicking, so it can cause the inflammation. So it would look like this. And when getting worse, the eye area involved, and we call it ocular rosacea. So you can see from those 4 different types. The type 1, subtype 1 is a erythematous things, which means cause the red nose, and the papulopustular rosacea. Okay, look like acne, but it's not. And the type 3 is called rhinophema. Yeah. And the last one is ocular, which means that your eye area is involved. Okay, so that's another photo for those 4 different type of rosacea. So the symptom for the rosacea sometimes can be slightly similar to acne, but you have to find out the difference. Normally, there's a trigger for rosacea, yeah, because sometimes it's too much sun exposure, or when they have spicy food, or alcohol, red wine, stress, or excessive heat, or sometimes it's cold, or when people doing too much exercise, or they're using different cosmetic, like witch hazel. I think it can cause something like allergy reaction. Okay, or some makeup can cause allergy reaction, or even some medication. Okay, so the treatment for rosacea is avoid trigger. Yeah, because those people will find it if you ask them, what make it worse? Sometimes they will think they will tell you when they exposed to the sun, the skin will getting worse. But for acne, it wouldn't happen because when people have acne, it doesn't matter when you expose to the sunlight or not, it won't make any difference. So you can tell that what's the difference between acne and rosacea. Yeah, see, acne won't don't have any trigger, or sometimes antibiotic can help for the rosacea if sometimes the bacteria involved, or some tetracycline or retinoid. Retinoid can use for rosacea and also for acne because the retinoid can regulate the skin and increase the skin turnover. Yeah. So that's why it works for rosacea and also for acne. And azelaic acid as well. It can work for both rosacea, acne. Or brimonidine. Brimonidine is an alpha receptor agonist. Okay. Or Sulentra. Yeah. If you have time, you can study more about those things. Or sometimes doctor would recommend any light treatment or laser treatment for the rosacea. Okay. So just let you know, there's in the pharmacy, when you see a patient have the rash, any pimple on the face, so you have to make sure, uh, is it acne or is it rosacea? Okay. So that's Sulentra. So normally for if the area is for inflammation area for the rosacea, you can use the Sulentra. 有没有看过 have you ever seen this product in the hospital? Sulentra? Remember like couple years when COVID-19 and before any vaccine comes out, people are looking for this ingredient because I don't know where do they get that information, because there's some research or some doctor recommend this ingredient can help for COVID virus, but not anymore. Okay, 有没有问题 Any question?
No, I have no question, but
Okay.